Hi everyone, as Teresa's just told you, my name is Jane. I'm the Head of Professional Standards. I thought I would start my presentation just by introducing myself. So I am a non-practicing barrister. I'm not an acupuncturist, so please forgive me for any terrible jokes or any mistakes I made. I trust you, I have consulted with BIACSI members when I have done this presentation. I've been working in regulation for the past 11 years. I've worked at the General Dental Council, and I've worked for another accredited register, which was the UK Council for Psychotherapy, who were very similar to the BIACSI in terms of obviously not being statutory regulated. As Teresa said, I started at the BIACSI last year as the Professional Conduct Officer, which meant I was dealing with complaints. I was very happy when I got my promotion to become the Head of Professional Standards because I wanted to support members rather than review complaints about them, to be honest. So I'm really happy that I'm now in this new role. What does Head of Professional Standards mean? I'm not sure if you've seen my latest letter to you all in ACU. It's on page 11, so if you have it, ACU are here at the conference. Please go and grab a copy. And I wrote it from my heart, so please do read that letter. It is to each and every one of you. Head of Professional Standards means that I'm in charge of CPD, developing policy, the PSA, the Advertising Standards Authority. This year, I will be primarily focusing on CPD, supervision and mentoring, and the new Professional Standards Committee. So that's enough about me. Let's get started. So why am I here? Well, I'm here to reintroduce, remind, and repeat. So before I do all those things, I just want to say I'm not here to patronize you. Obviously, as practitioners, you are completing patient notes every day, multiple times a day. So I'm literally here just to offer some reminders of what you are meant to be doing under the Code of Professional Conduct, and some tips that I've picked up from the naughty dentists and the naughty psychotherapists, and things I've seen throughout my career. So it can't help but hurt and share the knowledge. I will be repeating myself, and the reason why I will be repeating myself is because record keeping is straightforward. It's all linked. It's not that difficult, but it's extremely important because it involves yourself and the patient, the only two people that would be in a room. How would anyone know what's happened in that room if it's not recorded? So this is why I will be repeating myself, so that next week when you treat your patients, you'll be thinking, I should be putting down the GP details. That's what Jane told me to do. So that's what I'm going to be doing. So once again, Rob Strange told me to make some jokes, but I'm not very good at making jokes. I'm good at taking the mick out of myself, but I don't think that's the appropriate arena for today. So what are patient records? Well, so that's how some of you may feel. But yeah, what are patient records? So they are a chronological written account of a patient's examination and treatment. Now, I think this is really important to note. Like I said, I like to see it as a narrative. It tells a story of what happened as soon as that patient walks through that treatment room, what you saw, what you smell, what you felt when you touched their wrist and you felt their pulse. So, a patient's examination, that treatment, the patient's medical history, and any complaints or concerns they've raised with you, your findings. Now, the diagnostic tests and procedures and medications, obviously that's to do with the more Western medicine. However, if you are in a multidisciplinary practice and you share those notes, that then becomes relevant. Since I've started at the BIACSI, I think it's really important for me to share with you that at least once a week, I get a telephone call from a member asking me about patient notes. I've also spoken to loads of teachers and some supervisors on the BIACSI register, the Supervision and Mentoring Register, and they've fed back to me actually that this is actually a topic that keeps on coming up time and time again. And the Code of Professional Conduct is actually quite clear. And I think perhaps it's a document that's not referred to as much as perhaps it should be. So, like I said, I'm going to reintroduce you to it. That was meant to be a joke, by the way. Thank you. Section 1. You have a duty to your patients. Now, I said I wasn't going to patronize you, so I'm sorry, but you do. You have to maintain high standards of care, competence, and conduct. What does that mean? It means you have to look after your patients. It means you have to give them the best possible treatment you can. It means you have to record every pertinent piece of information. The NHS defined record keeping as personal information about a patient for the purpose of continuity of care. So I think that's very relevant here. Moving on to the relevant section now, which is section 7. So you must keep accurate, comprehensive, easily understood, contemporaneous, I hate that word, and dated case notes. When I was working as the professional conduct officer, when we receive a complaint against a practitioner, I'm not sure if you all are aware. So a complaint comes in, we review it, we see if there's been a relevant breach of the professional code of conduct. If there is, so I'll make up a fictitious complaint. So suppose someone said, I was needled in the wrong place and the acupuncturist needled too deeply. When they pulled it out, I fainted, for example. We would think, okay, that's quite a serious complaint. We would then inform the practitioner. How do we inform the practitioner? We would send them a copy of that complaint. When we do that, we would then ask them to respond to that complaint, but ask them for a copy of those patient notes to see what actually happened in that appointment. So, did the patient faint? Because if the patient fainted and you didn't note that down in your records, that's extremely serious. You'll be very surprised about the amount of people, and I use people, I'm not specifying this to BACSI members, I'm talking about statutory regulated practitioners who wrote all sorts in their patient notes. Either nothing at all, just the date of birth, saw patient X, this date, whatever treatment, that's it. That's not enough. Or, on the other hand, an essay. I'm not here to tell you what you should and shouldn't write other than what's in the code. It has to be accurate, it has to be comprehensive, and it has to be easily understood. I want to focus on 2 really important points. So what should I actually include in my patient notes? Section 7 actually details what you should be putting in those notes. The patient's personal details. Their name, Jane DeBois. Not really sure I'm consenting to my date of birth here, but okay, I'm born in August and the year of the rat, so I'll say that. Their address. You don't have to write their horoscope or anything further than that. That's sufficient. Presenting complaints and symptoms. As I said before, from the moment a patient walks through that door, you see, you smell, you touch. That's their presentation. That should be noted down. If the patient chooses to communicate to you, I'm suffering from endometriosis, I'm suffering from migraines, that should be noted down in your treatment notes. Relevant medical and family history. We have sickle cell anemia in our family. My grandmother died of breast cancer. All these things are extremely relevant. Treatment given and details of progress. So, I know I'm very aware of some practitioners that offer patients blocks of treatment for specific conditions. If that's the case, I think that should be detailed in your patient notes. Patient X came in, this is what they have. I think 6 treatment sessions will help with this condition. Some practitioners don't treat like that. However, if you choose to needle in a specific point for a specific reason, that's the treatment that you've given. If you're treating them for a specific condition, You're obviously, for example, migraines, it's not going to be cured in one session, as much as the patient would want it to be. It's a process. That process should be documented. Information and advice given, just like I said. As acupuncturist, I think, as someone who has recently undertaken having acupuncture myself, I'm now addicted, I'm having it weekly. It's really important, and I think the public are ignorant to how special you are. I think they perhaps have this view of you just putting needles in your patients, and that's not true. My acupuncturist is a confidant, provides advice, dietary advice, lifestyle advice. It's the whole package. It's not just about what that person's come into the door for. You know, some practitioners, I am aware, sit for 60 minutes and just talk to their patients because that helps, because they know that's what their patient wants. Perhaps no one's listening to them. So if you have just done that, just record it. Decisions made in conjunction with the patient. This is obviously to do with consent. If the patient doesn't want a particular type of treatment that you've offered, that should be noted down. If you've made the decision together, that should also be noted down. Records of the patient's next of kin and consent. Now, this is with regards to children and people who are unable to consent for themselves, or just the next of kin. So if someone has a reaction to the treatment you provide, and for some reason you may, and I really hope this doesn't happen, you have to phone 999, then it would be helpful if you had the number of the next of kin so that you could notify that person that that's happened. I would like to focus on points 2 and 4, which is patients presenting complaint symptoms and treatment. So I like to call them your collection of signs. They're very important. They form a vital basis of any diagnosis. Certain smells, sounds, pulses, changes can indicate changes to the qi, yin, yang, and your blood. As practitioners, it's really important for you to note these things because it's how you form your decision, how you arrive at the treatment. I've seen records whilst at the Biaxi with all of these things missing. So I think that it should be there. I'm not saying it has to be there. At a minimum, I would say the pulse should definitely be there. I think the tongue analysis should probably be there as well. But I do not want to be too prescriptive to you as members, but I think it's important for me to stress that if you make a decision on how to treat a patient, it should be clear how you arrived at that decision. So if these things are absent and you go back 2 years later and think, I treated patient X with this, and these are missing, well, how do you know why you made that decision? Does that make sense? Good. So needling. I'm going to say something a bit controversial. And yeah, I wasn't going to say it, but now I'm standing up here and I'm thinking, you know what, I'm going to do it. I've spoken to a few practitioners, and some of our members are extremely diligent. Like I said, some write the bare minimum, and I've spoken to probably around 20 practitioners that write the type of needle used, the size of needle used, the batch number, the expiry date, the width, the depth in which the needle is used, and I'm just going to read out what they wrote to me, perhaps even the angle in which the needle has been inserted. So I just want to make you aware that there are practitioners out there that go to that much length in terms of the description in their patient notes. I can see everyone's face. Picking your chin up. Yeah. That's why I said it was slightly controversial. I'm just sharing with you information that's been given to me. And I think the angle being used is perhaps a good point to make. And the reason why, and this would have been relevant because Ian was meant to go before me, is because of adverse incidents. So if you're needling in a specific area, obviously this is where my knowledge dips a bit, you definitely need to know what angle and the depth you're doing it at. So I'm not saying if you're needling, somewhere else, that wouldn't be relevant. But if you don't want to, obviously pneumothorax is the word that no one wants to mention. And so therefore, I think it is relevant to a degree that you have to be very wary about the angles in which you're needling. So like I said, it's slightly controversial, but I wanted to mention it as well. Points used, I wanted to touch upon that. I think it's difficult to write in the notes why you've used a particular point. I think for TCM practitioners, it's easier. I think for 5-element practitioners, I think it could be rather tricky. And the reason why I say that is because of the discussions I've had with 5-element acupuncturists. What I've heard from them is that the slight change to how you needle, it's difficult to articulate. With my lawyer head on, I would think if it can't be articulated, I think it needs to be summarized to some degree. We've had a complaint at the BACC, and it was really important to understand why a practitioner chose those points, because according to the committee that viewed that case, it wasn't conventional points used. So I would like to suggest that I think it would be great to note the points used and the reasons for doing those points. That's what I would like to suggest. Like I said, that's not necessarily prescribed in Section 7. Remember, Section 7 just says, note down the treatment given. So I've come up with 8 elements of good record keeping, which are accuracy, being legible, timing, jargon, scrutiny, mistakes, consent, and storage. I'll now go through each one in turn. So accuracy. It seems really straightforward, but during my time with the naughty dentists, quite a few of them identified the wrong patient. So please make sure you identify the right patient. And the mistake they made is because there were several Janes, the irony. There were lots of Jane Smiths. So if there are 5 Jane Smiths, please make sure on your notes you know how to differentiate between the 5 Jane Smiths so that there are no breaches and you do not make any mistakes. Similar as well with family members, I think that's really important. Make sure your records are marked accordingly so mistaken identity doesn't occur. Within this element of accuracy, I think it's obviously, it goes without saying, so once again, I am patronizing you. You have to listen. You can't record any accurate information if you're not listening. If you didn't hear something, please ask the patient to repeat themselves. That sounds so basic. Once again, I am sorry, but I'm just reintroducing, reminding, and repeating. Please, please, please ask the patient to repeat themselves. Make sure you've noted down the correct personal information and that the patient notes that you've taken is an accurate record of what has happened. So, for example, if an adverse incident has occurred, this should definitely be recorded in your patient notes. If the treatment you provided was subject to a PI claim, that should be recorded. If the patient requested a refund, that should be recorded. That all forms a part of the patient notes and making them accurate. Is it legible? So this is very simple. It almost makes me think saying, keep it simple, stupid. If you can't read it, if you can't understand it, then there's no point. Just write clearly. And I know that's difficult. You're providing treatment. Perhaps doing bullet points might be a solution. This also ties in with scrutiny. Somebody else may need to read your notes for any given reason. Like I said, unfortunately, if you become subject to a complaint at the BACC, we would need to read your notes. If you've referred to the patient to another practitioner, they would need to be able to read your notes. Section 14 of the Code of Professional Conduct also says if you write your case notes in any other language than English, it will then be your responsibility to provide a full translation. Please make sure the notes are written very clearly so that you are able to understand them. I've now been given a reminder. So let's speed up, which is ironically the timing point. This is another thing that's cropped up during my career. So please ensure that you write your notes during the consultation or shortly afterwards. I would like to suggest, if you are unable to take those notes during the consultation, perhaps bullet points. Then maybe a gap between each patient so that you can then consolidate what's happened during that appointment, and then give yourself time to refresh the notes for the next patient. That's what I would suggest. There are a lot of people, practitioners, healthcare providers, doctors, dentists, nurses, who do make up patient notes. You'll be very surprised about the regulated healthcare world. That's all I'm saying. You guys are very good in comparison. The other thing I want to say is make sure your notes are dated. Jargon. If you're using abbreviations and jargon, I remember when I first started at the BACC, I'm still learning all the abbreviations for all the different colleges, all the different references. Please make sure it's clear, you understand it. If you don't, please write down somewhere perhaps what the abbreviations stand for. Once again, you're not the only one that could potentially view those notes. Scrutiny. I bring this up because please do not write anything critical about your patients. Please do not use any sort of offensive language. Once again, during my time in regulation, I have seen some really nasty things written about patients. This is not just, I know. I'm talking about the way the patient looks. An extremely attractive woman. I would like to do something to her. Oh, that person wouldn't stop talking. Oh, this person wouldn't stop moaning while I was treating them. It happens across the board. If a patient requests their notes and they see that comment, I don't think I need to say anything else. Please, please, please be careful about what you write in your notes. It's really, really important. I can't stress that enough. They will be viewed, they could potentially be viewed, like I said, PI claim, complaint, the police, an employment tribunal. You just don't know. Mistakes, we all make them. Strike through any mistake you make. Really simple. Make it clear you've written something incorrectly. If you need to add something, make a correction. Make sure you enter the date either below or aside. If it's on the same day, if you go back and view your notes, maybe 2 hours, a day afterwards, and you think, hang on, that was a mistake, make sure you cross it out and you put the date of your amendment. Put the correct information either below or beside it so that it's really understood. Do not take the pen and it looks really dodgy if someone then looks at your notes and thinking, well, hang on, what was this practitioner up to? Consent. I'm very wary of time, and this is probably the most important thing to say. That's the definition of consent. This must be done on an explanation by the practitioner. Consent must be voluntary, and it has to be informed. The person must have the capacity to make that decision. Once again, I've spoken to several different practitioners. Some practitioners have written consent forms, others don't. There is no wrong or right way. The right, my way, and this is what I'm going to share with you, is that if your patient doesn't sign a written consent form, please write in your notes what you informed them and that they did this. And then held out whichever part of the body you chose, you told them you were going to needle. That is them communicating to you that they are giving you consent. If you are not clear, once again, repeat the question. Say to them, this is what I am about to do. It is really, really important. Consent is such a big thing. You have to be clear that you've obtained consent, not only from the patient, or if it's a child and the parent is in the room. You have to be very clear about what you're about to do and why you're doing it. Like I said, consent could be given verbally or in writing, but the person must have the capacity to consent. Storage. Really straightforward. If you have a paper file system, which quite a lot of our practitioners do, please ensure that it's behind locked doors in a locked cabinet. Now let's sit here and think, who else? Everyone in the room, the majority must have paper records. Let's sit and think, do you have paper records? If the answer is yes, I'm seeing people nod their head. Where the records are, is it in a locked building? Good. The room in which those records are in, is that locked? Okay. Okay. The filing cabinet in which that, okay, good. The filing cabinet in which the records are stored in, is that locked? Okay, one more question. Who has access to that filing cabinet? Are you the only person? Oh, good. Where do you store the keys to that filing cabinet? That's the question. Okay. Do you see the point I'm trying to make? We have to be really careful. It's confidential information. We're all aware of GDPR, data protection. We must make sure that we store the records in a confidential and safe manner. Electronic records. Please make sure if you're using a password, it's not your name and your date of birth. Anyone can guess that. It's not the same password you use for all your electronic data systems. Please make sure it's very specific. My top 5 frequently asked questions that I get from practitioners. If I treat a 15-year-old patient, do I need to obtain consent from their parent or guardian? Would anyone like to answer this? Yes, you would like to answer it, or yes, you need to get consent? I told you to be clear, so which one? Good. If I work in a multidisciplinary clinic, who owns the patient notes? Who's me? Why? Okay. If I rent the room, do I own the notes? If I'm an employee to the clinic owner, do I own the notes? It's not straightforward. You process the information, but they control the data. Yeah. Where should I store my records? Please tell me you just listened to me. Did you listen? In a locked room, in the locked premises. Okay, good. How long do I retain patient notes? Okay. Okay, good. Do we need to sign our patient notes after each appointment? Who said yes? Why? Okay. Okay. Good. I like you. I like that. That's a really good approach. Who said no? I'm not going to tell you off. Don't worry. That's fine. I would say no, you don't need to. The only reason you would need to sign your patient notes is if you're extremely diligent and that's the choice you make, or you're in a multidisciplinary practice and several people are treating the same patient. It has to be clear who's provided that treatment, on what date and why. Yes? Mm-hmm. Okay, let's talk about that nervousness after this. Is that okay? Okay. Right. Ooh, sorry. At 15, they can be perceived to consent to their own treatment if they are capable of doing so. I like to say safely that the age of 16 and 17 is the presumed to have sufficient knowledge and capacity to consent to their treatment. I tell all BIAXI practitioners, 15 and 16-year-olds, I would consult with their parents just to err on the side of caution. That's my advice to you. Yeah? I'm just really wary. I think it's always best. You don't want to make any mistakes. So I just think it's always best to consult with the parent. If the parent says they are more than happy for the 15-year-old or 16-year-old to make that decision, and they don't have to be in the room, get them to jot that down and get them to sign something. That's just me erring on the side of caution, though. Okay. When does someone become an adult? 16. In terms of medical treatment, 16. Yeah. That probably answers my question, because I remember my doctor saying, yeah, I'm coming up on behalf of my son. Yeah. It's when they say they're confidential in a confidential relationship with their doctor in the NHS. It is fast changing. I can concretely say 16 and 17 is definitely legally the age of children being able to have the capacity to make the decision for themselves. However, we're in a fast-paced society. The NHS haven't made their mind up. 15 is an acceptable age to make decisions. Is that clear? I'm sorry. The NHS is unclear, so I'm unclear. That's why I say, please do consult with the parents and make sure they are happy and think that their child has the capacity to do so. Yes. Yes. In terms of not providing treatment? Yeah, Teresa's going to come and advise you on that.
So first things first about the 16, I think the Code of Professional Conduct says that you need to have the consent of the parent and have the adult in the room until they're 16. So that answers that question. With regard to withholding consent, again, the Code of Professional Conduct says that even if you have the consent of the parent, but the child declines consent, then it wouldn't be appropriate to treat them. You put yourself at risk of a case against you. So I would say, whatever age the child is, if they clearly don't consent to the treatment, you shouldn't proceed. You would need the consent of both the parent and the child. That's a safety first approach. Debbie? Yeah, I know. I think it has to be professional discretion and a judgment call, but I think certainly with teenagers who clearly know their own mind, I think any child sort of like puberty upwards, even 10 years upwards, if they are clearly not consenting, it would not be safe to treat them even if you have got the parents' consent. Yeah, I think 7 might be safer, but I think you have to be really careful in those circumstances. Any more? Back to you.
Thank you. So, thank you, Teresa, and thank you everyone for listening to my talk about record keeping. I wanted to speak to you quickly about supervision and mentoring. I informed you earlier that I will be focusing on it. I will be relaunching the BIACSI register, and that is going to be the new logo for the BIACSI Supervision and Mentoring Register. I think as acupuncturists, you face many challenges in work. It's an extremely rewarding profession. Many of you work alone, dealing with professional isolation, potentially, or with difficult cases or challenging clients, as well as trying to maintain a healthy work-life balance and good boundaries. Regular mentoring sessions will help to explore all of the issues that arise in practice in a safe and non-judgmental space. A skilled supervisor will support you in navigating your way through difficult challenges you may face in your professional and personal life. Many healthcare bodies actually have supervision as mandatory. The BIACSI haven't taken this step yet, but I do want to promote the incredible benefits of regular mentoring and supervision. I've attended a supervision group myself recently, and it was really, really, really powerful. So I just wanted to take time to let you know this is what I am working on. I'm going to spend the weekend on the stand. Please come and see me. One of our governing board members, Kathy Chapman, she is on the register. She will be in and around. She's more than happy to talk to you all about this. Please, please, please do try and come and speak to me about it. It's something that means a lot to me. So, and it will mean a lot to you if you really just, please try and explore it. So I just wanted to spend the time to talk about that. So try and join us. If you want to contact me, you can, anytime. That's my email address. That's my number. I'm on Jeddo Road. I think everyone knows the address by now. So thank you for listening to my talk today.